Good afternoon. I'm Nick LaRusso, and I'd like to welcome you on behalf of the Mayo Clinic Center for Innovation to another new experiment from the CFI. This is the beginning of a new speaker series that we've decided to embark on entitled Thinking Differently, the CFI Series of Unexpected Conversations. I'm very pleased to see such a large turnout today. I explained to Tim that the free lunch had nothing to do with it. It was because they heard that Tim was going to be speaking. So this new series that we're going to embark on today is an experiment. We're going to be bringing in people from diverse areas, probably less often from medicine than you would be used to in a more traditional series. The goals here are to provide diverse perspectives that have relevance to healthcare from areas outside of healthcare largely. We want to provide an immersive experience for the visitor. So Tim is here for, and I'll formally introduce him in a minute, Tim is here for a couple of days. We'll be telling you, we'll be talking about what he's doing when he's not here, leading off our speaker series. We want to engage as many diverse areas of the Mayo Clinic to participate in this as possible, and I'm pleased to see people from so many different disciplines here, and also people from outside of Mayo. People from education within Rochester are here at multiple levels. So we're excited about this initiative. We look forward to your feedback, and we'll see how it goes. Let me take a few minutes and introduce our guest speaker today, Tim Brown, who's the CEO and president of IDEO, which is arguably among the premier design consulting companies on the planet. And Tim speaks frequently about design thinking and innovation to business leaders, government leaders, et cetera. He, as an example of the value that's given to his input, he speaks at the World Economic Forum at Davos, Switzerland. He's published a book recently, which we'll talk about, called Change by Design, which in my opinion is, if you're going to read anything about design, or only one thing about design thinking, that's the book that you should read. He's an industrial designer by training. He's originally from the UK, but he's been here for many, many years. Lives in Palo Alto, where he leads IDEO, although increasingly he's spending a lot of time on planes, since a significant proportion of IDEO's work now is global. And he's very interested in design thinking as it relates to healthcare. I'm fortunate to have him as a member of the External Advisory Council of the Center for Innovation. He's led strategic discussions with leaders from Microsoft, PepsiCo, Procter & Gamble, Steelcase, et cetera. And he's written articles for Harvard Business Review, The Economist, and as I said, he's published a key book called Change by Design. He lives in Palo Alto with his wife, Gaynor, who's an educator, and his two daughters. His daughter, Caitlin, is a physics major at Occidental College, which is in Pasadena, and he's all excited about the trip he's going to make with his wife and his youngest daughter, Sophie, to Princeton, where she'll begin school in September. So let's give a Mayo Clinic welcome to Tim Brown, and then we'll begin the conversation. The way we're planning to do this is I'm going to ask Tim a series of thoughtful and interesting questions, which were developed by my team. I'm not taking any credit for that. And we'll keep this in a conversational mode, but then we hope to leave about 20 minutes at the end for dialogue with the audience. And we have people with microphones when we get to that part, so I hope there's active participation. So, This is the book. It's called Change. I'm not selling his book, by the way, but
You're
I
doing a
want to
good
start
job
off
selling
with
it.
that.
Thank you.
This is the book that Tim wrote, Change by Design, How Design Thinking Transforms Organizations and Inspires Innovation. So why don't you tell us what design thinking is all about and how it transforms organizations and inspires innovations?
I'll do my best. Paraphrasing a book in 3 minutes. No, I mean, the best definition I can think of for design, which actually occurred to me after I wrote the book, so it's not even in the book, which is sort of weird, but is that really the process of design is the interface between the man-made world, everything we create, and us as human beings. If you think about it, everything that we create to some degree is designed. There's lots of stuff we don't create that comes from the natural world, which clearly we don't design, although we're beginning to make some fuzzy edges to that notion these days with some of the things that are going on in medicine and science. But everything else is designed in some way. Every chair you're sitting on, the chairs you're sitting on, the room we're in, the cars you drove to work today, the processes that you use in your organization, they're all designed. They're all created with an outcome in mind. And that's really what design is. And so design thinking is the methodology which one uses to do that. Many of them are intuitive, and you know, I would argue that at an intuitive level, every human being is a designer, because we all solve problems that affect that interface between the things that we have around us and us as human beings. We all do stuff with that interface, whether it's designing a dinner party for friends, or a birthday party, or rethinking the way you go about your job. I mean, they're all designs that we do. We tend to use a lot of the time we're fairly intuitive about the way we do that. But there's a kind of a profession of design that's emerged over the last 100 years in which those methodologies have got a little bit more formalized. And we've begun to understand kind of the things that work and the things that don't work. And that's what I would argue are the kind of principal methodologies of design thinking, is what I try and describe in the book, which I believe are useful to people who are not professional designers. Just in the way that I think you would probably all argue that the scientific method, an understanding of the scientific method is useful to anybody, not just to practicing scientists. Or analytical thinking is useful to anybody, not just to scientists or business people. So I would argue the same for design thinking.
So part of the reason Tim is here is to learn more about the traditional scientific method, and the way he's going about that, rightly or wrongly, is he visited my lab this morning and attended a lab meeting, and tomorrow he's going to be attending a lab meeting in Gianrico Ferrugia's lab. So we can get maybe more into a comparison of the two methods later on, but try to explain what's unique about design thinking as it relates to the process of framing and solving problems.
Well, I think there are multiple things that are different about design thinking from perhaps from science, but one of them is the outcome we're looking for is a little different. Right? I mean, this is my interpretation anyway of science, is that the outcome that we're principally looking for is new knowledge, truth, if you like. Now, that truth and knowledge can be applied to different things, but the outcome of science is truth and new knowledge. The outcome of design is always an artifact. Now, that artifact doesn't necessarily have to be physical. Now, I was trained as an industrial designer, so I was trained to create physical artifacts, things that hurt your toes when you drop them on your foot. But there are lots of artifacts that we design that are not physical, like a process, for instance, how we go about something. But that is the outcome for design. In terms of the methodology, one of the things that, because we're interested in this interface between people and stuff, the place we generally go and look for our principal inspiration, for the starting point for our ideas and for our investigations, are people themselves. So design thinking is based on a kind of observation of the world. It's based on but principally observation of people. Whereas I suppose you could argue that science is based on the observation of physical matter or scientific phenomena or whatever. So this sort of starting with people, this human-centered notion to it, is something that is important to design. It's not only unique to design, but it's important to design. I think another important notion of design is that it's a process of synthesis. Design thinkers, when they get to solutions, are assembling lots of pieces together to make something that's whole, which I think is a little bit different from the process of science, which is often about pulling things apart to get down to something that you can study with accuracy. We're not that interested in accuracy in design. Because there's never one optimal choice. I mean, I think this is something that's important to remember about design. One of the things that makes it often quite difficult for scientists to feel comfortable with design is that there's never just never one version of the truth. I mean, as you all know, there are thousands, if not hundreds of thousands, of designs of chairs in the world. Some are more optimal than others, but there's no perfect design of a chair. So there's always a large set of possibilities. And so we're not really interested in the truth. We're interested in an optimal solution that meets the set of needs that we might be that we might have framed our problem with at the time.
Are there? I think one of the points that you've made more often than not, and is implicit in your comments up till now, is that design thinking is a methodology, and while designers are pretty good at it, you don't have to be a designer to understand design. Are there characteristics of individuals that make them more effective in the application of design thinking?
Yeah, I think there's some of these characteristics which I suspect are similar to good scientists, and they have to be inquisitive. Right? I mean, if you're not interested in asking questions, as far as design, it tends to be asking questions about why people do this or why things don't work, and how they might work better. If you're not inquisitive, then you're unlikely to be a great design thinker. I think it's helpful if we're all inquisitive. So I think that's a quality that we could all do with. I think design thinkers, the best designers are empathic. In other words, they can look at the world through the eyes of others, through the eyes of the people they're trying to serve or design for, rather than just their own needs or their own eyes. I think that's a useful trait. Design thinkers are comfortable with the idea of learning through failure, and we use a mechanism we call prototyping, which is about kind of the equivalent to experimentation in science. I think we can talk more about that later, about the differences and similarities. But prototyping is the way that we learn. We make things, right? We make our first version of something, and it's usually really bad, and we learn that it's bad in certain ways. Then we make another version.
Give an example of a prototype that people might be familiar with, or might be relevant to them.
Well,
something connect with it.
Something that you might connect with is so we were working on a project some years ago. It was a medical instrument. It's a medical instrument for doing sinus surgery, and we were working with a team of surgeons, as we always do when we always work, particularly in healthcare, work with experts. So we're working with a team of surgeons, and these surgeons were trying to explain how this thing had to feel to them when they were at the operating table. So one of the designers was listening to them. They ran out of the room, went and grabbed a kind of whiteboard marker, a clothespin, and a film canister. Now you can tell how long this might have been a little while ago, because film canisters are a rare beast these days. And they sort of assembled them all, kind of taped them all together in this rough form that represented what they were hearing from the doctors. Ran back in the room 3 minutes later and said, "Oh, you mean like this?" And the surgeons grabbed hold of it and said, "Well, a little bit like this, but actually if this moved here and this was..." And so that prototype, that 5-minute prototype made out of a bunch of junk, was a way of progressing the conversation about what was the appropriate form for this, what was actually a very precise medical instrument. And so, then as that design goes on, those prototypes get more and more sophisticated and ultimately get closer and closer to the real thing. But that initial 3-minute prototype was perhaps the most valuable prototype out of the whole project.
So, as I've become, incidentally, how many people who are not in the CFI have heard of design thinking before today? Raise your hands. Let me just get a...
Hey, that's a pretty good...
Well, I mean, how many of you have bought the book? No, I mean, you obviously, this leads to my next question. Design thinking is getting a lot of press now, and it's getting a lot of attention in industries outside of medicine. But more recently, and particularly with some of the work that IDEO has done and some of the work we've done together, design thinking is being applied to healthcare. Could you tell us a little bit about why you think it's going to be useful, and why IDEO is particularly interested in healthcare, and maybe anything that's not proprietary, maybe some things that you're already doing in healthcare?
Well, I mean, the highest level, if there was ever a system which is about the interface between the man-made world and human beings, it's medicine, right? I mean, because medicine is our is a direct intervention into us as human beings and our health, and everything we do about it, everything we've discovered, all of the clinical practices we use, the systems of healthcare institutions, the financing system around, is all that stuff. And so making that more effective, making that a better experience for patients, making it a better experience for medical practitioners, making it more sustainable from a kind of economic perspective. They're all things that we need to and want to achieve. That's a great place for design to play a role, and design does play a role in everything from the design of the physical artifacts of medicine, so the devices, whether it be the disposable devices, the pieces of technology that you will use in your practice. I mean that, and one of the things I love about medicine actually is that physicians, particularly surgeons, I think, often have a design mind, and the many of the entrepreneurs that we've worked with in medical devices have actually started off as physicians, and they've recognized a need, whether it be a new kind of heart valve or a new instrument, and they've wanted to start a company around it, and we've worked with them to help develop whatever that device is. So that's the kind of a very obvious place where design plays a role. But more and more we're seeing that there's a role to play in the process of medicine, particularly not so much in the clinical process itself, although I think when we start to think about chronic disease, there may be places where design can play a role in the clinical process, but in all of the patient experience around that. I mean, given that, I think it's relatively clear that in medicine, patients are part of the process, right? You can't treat them as inanimate objects, much as we might like to occasionally, and so they have to participate in the process. So the more informative, transparent, effective, whatever it is, safe, whatever it is, we can make that process for patients, the better it's likely to be. So there's an opportunity for design to play a role there, whether that be in some of the work that we've done together, in Spark, for instance, in trying to understand better how the kind of doctor-patient kind of relationship works and how you can improve those interactions, or we've done work with Kaiser Permanente, with nurses in particular, on how nurses and patients work and together, and how processes might be improved. One particular thing that came out of the work we did there was in that case, we were similar to working with you guys here. Our roles was really more as kind of coach than it was actually as designers, but the teams of nurses at Kaiser redesigned the way they changed shift based on observations of how it was working already, seeing that it was inefficient, and from a perspective of, I think on average at the time, nurses were spending 40 minutes away from the ward floor in the nurses' station, swapping information backwards and forwards about the states of patients when they changed shift. And that was obviously there was a lot of time away from the ward floor, but it was also resulting in not optimal information exchange in a lot of cases. So based on that observation, they prototyped a whole bunch of alternatives, designed a little software tool, and developed a new process where now they change shift in front of patients on the ward. They've brought the average time that they're off the ward down from 40 minutes to 12 minutes. So that's a pretty major just time improvement when you multiply that by all the nurses, all the shifts, all the wards, and all the hospitals that Kaiser has. Perhaps even more interestingly, they've significantly increased patient confidence, because now a patient can hear the information that's getting transferred and interject when there might be something wrong, or might there be some useful extra information. And thirdly, and also interestingly, it's increased nurse happiness. And so that was a very simple process redesign based on a sort of design thinking approach. So processes within healthcare institutions are a place that we're working. The environments, obviously, of healthcare institutions are places that can benefit from great design. I mean, for those of you who've had a chance to visit the Center for Innovation, I mean, you would put a lot of work into the design of that space to make it a better collaborative space. Well, equally, we can make healthcare institutions better spaces for whatever purpose they're designed for. We're beginning to work on the financing side of healthcare. We're doing some work right now on some of these new healthcare exchanges that came out of the Healthcare Reform Act. Again, looking at how to make them understandable for consumers and patients. That work will be mostly based on what gets delivered via the web. Lots of opportunity to do software applications that support medicine. And we're seeing a lot of kind of entrepreneurial activity in that area. So there are many, many facets of the healthcare arena that I think design can play a role in.
We had a discussion last night where talked in a little bit more this
I
morning.
think you've dropped your microphone, Nick, so
Sorry?
they're not hearing you.
Maybe that was a good thing, right? But so people talk about Henry Plummer as the first systems engineer when the term didn't exist. We talked about the Mayo brothers as being among the first in healthcare to apply the methodology of design thinking before the term even existed, because of the human-centeredness of what they did, the fact that they were so much involved in the process of delivery and the experience, the fact that they reached beyond medicine to the business arena. So I think there's some history, if you will, in our legacy that recognizes the value of that approach to problem framing and solving.
There's a very interesting relationship, actually, between design thinking and entrepreneurialism. They're quite close to each other in many ways, and so this idea of building a venture that ultimately serves customers better and therefore becomes a successful business is not that dissimilar from the idea of designing systems that meet the needs of the customer better and become therefore better systems, and so what I often find that great entrepreneurs, particularly ones that figure out how to build something that goes beyond that initial startup phase, are often either intuitively or in some cases explicitly, because we have more and more designers involved in that now, good design thinkers. And so, in the book I talk about a great British engineer, a guy by the name of Isambard Kingdom Brunel, who developed the first long-distance railways in Europe, but based them on and I think I talked about this actually in my Transform talk when I was here a couple of years ago, based that not on the idea of just making a more efficient railway, but he had this concept of wanting to have the experience for passengers be floating above the countryside. I mean, that's a really kind of design idea. And this was 100 years before the design profession even really emerged. And I think you can find many, many examples of people who essentially think like designers. And unfortunately, I think while those entrepreneurs who kind of bubble up and are very successful, compared to that, there are many of us who aren't exposed to that form of thinking, aren't offered the chance to build our skills in this arena. In many cases, I would argue, have it kind of beaten out of them as they go through a conventional educational process, such that we don't have access. We don't feel confident. One of the things we talk about is creative confidence. There's something about the design process which is a willingness to enter a creative process without knowing what the outcome is going to be. You do need a certain sort of self-confidence in order to do that, because the very definition of design is if you can answer the question before you start, there's no point designing. And so you've got to be willing to go into a process without knowing what the answer is going to be. That requires confidence. I think confidence comes from experience. It comes from having done it. It comes from having tried it out and seeing that it works. And so I think it's unfortunate that for the vast majority of kids that they don't get an experience of design when they're at school.
You mentioned in a rather laudatory way the experience you've had with a subgroup of physicians. Having been involved now with the Innovation Center for 3 years and having been involved with designers for probably 3 years, Julie, right before that, right, with Spark, there's a tension that often exists between the way physicians, or even, let's make it more general, healthcare providers are trained to think, and designers. So for example, healthcare providers are trained to get to the answer as quickly as possible. And we were talking about this morning, that it's rare for a provider not to want to walk out of a meeting with a to-do, something concrete that's going. What's been your experience, present company accepted, because we're all enlightened at the Mayo Clinic, what's been your experience with dealing with different groups of individuals from different areas, as how they intersect with design thinking and designers?
Well, I think there are often unrecognized but deep differences in the starting point that cause, some friction when it comes to working together. That you have to kind of go back to that beginning point to understand why that might be. And and I think actually that I actually believe designers are interested in making progress quickly as physicians are, but there's a different process for getting there, and so I think where that difference in approach might come from is that as a physician, you're used to wanting to find the single answer, right? Because in theory there is a single answer. There's a reason why somebody's sick, and there's the right response to that in order to heal them. In design, there's never a single answer, and so there is always a desire amongst designers, design thinkers, to explore what that range of options might be, and there's a tendency to want to explore that range of options forever, right? I mean, and the reality is, if for most designers, if you don't give them a deadline, they will never make a decision.
Did you hear that? Where's the group from the CF?
But there's a reason for that, right? It's because in theory, there's always a better option out there, right? Always. And so you've got this tension that design's operating under all the time, which is the desire to get to an outcome that creates value in the world, and the fact that you know darn well there's a better one that you haven't thought of yet. And so I write about it in the book. I mean, without deadlines, design wouldn't happen. And so we actually had an interesting conversation this morning when we were in the lab about, there's a reason why design process is always described as a kind of a left to right thing, whereas scientific processes tend to be described as a vertical thing, right? And I don't completely understand why science is described as a vertical thing, but I know darn well why design's described as a horizontal thing is because it's only with the march of time that we make any progress. And so we're sort of always thinking about, okay, when's the deadline? When do we have to present our ideas? When do we have to decide which one we're going to do something with? And so I would suggest that that drumbeat is essential, and then understanding what that drumbeat should be for any given problem. I mean, one of the struggles I think we have working in healthcare is that the problems are extremely complex. Right? I mean, designing one of these, designing something like this, which is complex in its enough in its own right when you think about the supply chain, all the things it takes to manufacture, trying to do that more sustainably to the point that there's so little material in these now that when you pick them up, there's a risk that they collapse and squirt the water out of the top. But there's a reason why the wall thicknesses on these things have got thinner and thinner and thinner. It's to try and save material. So that's complicated enough, but it's sort of something where you can get your head around and you can do it pretty quickly. But if you're talking about, the design of a new, operating theater, or the design of a better sort of the future of wellness at home, or the sorts of challenges you're trying to take on, they're massively complex, and so the drumbeat for those has to be a little different. And I don't think we yet understand quite what that needs to be really frank with you.
Aside from the complexity of the problems, are there characteristics of organizations that are more likely to be receptive to the methodology of design thinking, or more resistant?
Well, yes. I think that's kind of
Next
obvious.
question, right?
Next
okay.
Question. But I think organizations that are outcome oriented are more likely to be receptive to design and be a better environment for design, even if designers get frustrated with how quickly those outcomes are expected. And so, I like working in businesses that want to get stuff done and that know how to get stuff done. And I find it very frustrating to work in institutions that don't know how to get stuff done. I think this is an institution that does know how to get stuff done. There is a tension sometimes between how things get done. I think, to be really frank, in a medical institution, there are tensions between the sort of conventions of the sort of hierarchy that you guys operate under. Physicians are all powerful, and in design we're not used to that idea, and that can be a little stressful sometimes. But I think significantly it's about a desire to get things done.
Could you talk a little bit about design thinking vis-a-vis innovation? We're fortunate on the External Advisory Council. We have, in addition to Tim, we have some brilliant people. One of them is Larry Keeley, and Larry heads up Doblin, which is an innovation consulting firm, and he sees, and I think many of us do, see innovation as a discipline. He has analytics for it, et cetera. Talk about design thinking and innovation.
And Larry hates the term design.
Well, I know that. I didn't want to say that. But,
I mean, I actually go back to some of the work that Peter Drucker did back in the 1980s. He wrote a great book called Innovation and Entrepreneurialism, I think, or Innovation. Yeah, I think that's what it's called. He, in that book, describes, I think, 9 different types of innovation. And I think you could argue that 2 or 3 of them constitute design thinking, but there are many others that are not. So science leads to innovation, right? So there's technology-based science and technology-based innovation, which is not the same, because as design thinking, it often starts with technology. It doesn't necessarily start with people. It may have ultimately apply that technology to people, but it doesn't start there. It starts with a discovery of what technology can do, or what science can do. That is equally, that is innovation. I don't claim that design thinking is the way you go about that. And so, I would suggest that there are multiple forms of innovation. That, if innovation is about creating new forms of value that an institution or an ecosystem can deliver into the world, and that value comes in the form of some artifact or other. It is a new piece of technology, it's a new piece of IP, it's a new process, it's a new product, a new service, a new experience, a new policy, perhaps, if you're a government. But it results in some kind of artifact. But you can get there using multiple approaches. And so, I believe I'm reasonably expert in one of those approaches, and it's called design. Design thinking is the stuff that we do in order to apply design. So that would be my definition of the relationship between the two. I think that any institution ought to be, if not adept at least cognizant of multiple forms of innovation. And here at Mayo, I think you are. Right? I mean, in the Center for Innovation, you're focusing principally on design-based approaches to innovation, but not only on that, but principally on that. But you've got other forms of innovation going on within the institution, in your lab, and in everybody and other labs. You're working with technology providers to look for new technologies that do things. So, I think you're a good example here of an institution that's looking at innovation in a multifaceted way.
That's a good segue to this issue, which is one of the reasons you're here, to look at the intersection of the traditional scientific method with design thinking. And your visit is not complete. You still have to go to John Rico's lab meeting tomorrow. What sort of ideas did you bring to this? And has anything even changed to a small degree after the lab meeting this morning?
Well, what I came with was this sort of well, I've got a point of view that experimentation is extremely important in design, and that experimentation is a way in which we discover new possibilities, and we do a lot of things we call experiments inside IDEO, but we're not very rigorous about it, and I don't think we really know what we mean when we say the word experimentation. So one thing that I brought here was trying to understand a little bit more clearly what good experimental practice actually is, and the role of things like the hypothesis, and the role of the role of the question you ask before you get to the hypothesis, the role of the experimental process itself, what that experimental process is then supposed to lead to. Now, I don't think that you can take that and just say, okay, now do that with design, because there are some differences. But I do think there's some really interesting kind of points of intersection, and I actually do think this concept of the hypothesis is a really important one that we're not very rigorous about in design. And that I already learned some interesting stuff this morning in our discussions about how you think about that. Not least, one of the things we tend to do in design is, we have this concept. We tend to leap for the finish line. So we have a hypothesis and we expand it out as far as it will go and make it as big as we can possibly think of, and that's exciting for us. And we tend to do that. And I've noticed that you all in science are much more reluctant to do that, right? You take it in a kind of stepwise fashion, making sure that that you've proven one step of the hypothesis before you move to the next one. You may be thinking about the implications at some level, but you're not making claims for them, which we tend to in design. We make claims for our hypotheses much too quickly. So I think there's something interesting coming out of that. I was also interested to hear a lot about what I was hearing this morning about how important storytelling is in science, and it's very important in design, right? I mean, we have these ideas. These ideas are still nascent in a lot of cases. We may have done experiments to show data, and we may have created prototypes to show that there's some utility in our idea, but we haven't necessarily got all the way yet. And so our ability to tell a story about what we've done, what we found out, what it means for the future is equally important, I think, between science and design. And so I think there are potentially things we can learn from each other about that. I think you have ways in science of measuring impact, which are based to do largely, I think, with the usefulness of knowledge. Whether it's citations, you talked about this morning about this kind of impact ratio, and that's important. Whereas in design, that's certainly not unvaluable. It's just that we're more interested in design and trying to measure impact in the world of the artifacts that we create. That's really difficult to do. Really difficult to do.
Talk a little bit about the insight that I thought was really interesting this morning about the role of critical assessment of things as they move along, and the two different, recognizing there's an overlap here, but for the sake of discussion, we're differentiating the traditional scientific method with design thinking.
Well, again, I think it does come back to this fundamental difference between science and design, which is one is the search for truth, one is the search for potential multiple options, and then us ultimately deciding which of those you prefer or which one of them is optimal. And that changes the role of criticism, right? I mean, so in the scientific process and the scientific method, criticism at some level can be harsher, I think, because you are trying to pare it back down to the truth as you understand it at any given moment. If you do that in the design process, you risk squeezing out all of the creativity in the process. But at the same time, rigor and rigorous criticism is a really valuable thing in design, but it tends to be more about, have you explored enough alternative or the right alternative paths, rather than have you got to the right solution. And so I think for you, I mean, you're in a really interesting position, right, individually, because those of you in the Center for Innovation who've also got labs, you're having to go backwards and forwards between these two different kind of approaches. And so I think it's an interesting, I mean, you and John Rico and others, you may actually be in a unique position to understand the similarities and differences between how you can be most useful when it comes to kind of criticism and review in design versus science. I think we could learn a lot from the experiences you guys are having, because I think you found it can be frustrating for you and frustrating for design teams when you apply exactly the same processes you might apply in your lab in the center.
So good. I'd like to invite members of the audience to raise their hand if they have a question or a comment. We have microphones that we're prepared to provide to those of you that would like to engage Tim in a conversation. Anybody? Oh, good. We have someone.
Good afternoon. Do you hear me? Do you think so? Good afternoon again. I read the op-ed or essay in Sunday's New York Times by Neil Gabler about elusive big idea, and it was quite disturbing because he said that we are living practically in a not only post-Enlightenment era but also post-IDEA era, that we are amounting Mount Everest of information, but really nobody who is willing to think about this. So I was wondering, what would your response be to that thinking?
I didn't read the piece, so I can't comment on it directly, but I think it's possible that we may be confusing a couple of different phenomena. I mean, there's no doubt that we have these ever-growing layers of systems on which we can build. And so it's now possible to accrete and add to those layers relatively easily. So, I mean, if you think about, you know, all of the rage that's going on in Silicon Valley right now around social network, new social network businesses, you know, people making big claims for them. They're actually just another layer on top of a whole bunch of layers that have been built over the last 100 years that include, you know, obviously at the basic level included electricity, then it included the computing, then it includes the internet, then it includes search, and eventually you get to things like Facebook as social networking tools. Oh, and by the way, now we've got companies like Zynga who have built their whole business on top of Facebook. So we've got this accretion of layers, which on the one hand kind of creates lots of buzz and feels like it's really exciting, and on the other hand doesn't feel like a very big idea, right? I mean, it just feels like it's sort of incremental. So you know, I can understand why people might get a bit frustrated with that, but I at the same time believe that that we're trying to there's more and more evidence that we're trying to tackle kind of complex phenomena and complex issues in a way that we simply didn't think about 50 years ago or 30 years ago. We weren't thinking about you know, healthcare as a big interconnected system. We weren't thinking about the environment. We weren't thinking about, you know, ecological issues, not from a perspective of trying to solve them. There were lots of things we weren't thinking about, and we are thinking about them now, and they feel like pretty big challenges which are going to require big ideas to solve them. So I don't know. I don't feel like we're living in an age without ideas. I just think we may be living in an age where the ideas are more complicated and a little more difficult to describe, and that perhaps we're beginning to get beyond our capacity in general to understand the ideas that we're developing, which may be a problem. And so I'm not quite sure what the solution to that is. Either it's we're going to build devices that are able to understand these things in the way that we don't, which I guess is a form of evolution, or we'll get used to living in a world where we only understand a very small piece of it. I'm not sure which of those two outcomes we'll end up with. Maybe both. I don't know.
Another question? Can we get, Linda, can we get the gentleman with the blue shirt?
Yes, I'm a developer. Before that, I was a scientist, I guess. And I see a problem of focusing on segments of a problem, breaking it down and solving in design or anything, of focusing on subsegments and not focusing on the system as a whole. So how do you focus? It seems like we need to focus on the systems as a whole for good design.
I mean, I agree with you to a point. The only problem with that, and this is something that I'm beginning to grapple with personally, is that, you know, as we understand how complicated these systems are, we realize our lack of capacity, as we were just talking about, to actually think about the whole system. Now, I was trained as a designer. I mean, design is a process of synthesis, right? I mean, it's a process of assembling pieces together to get to a whole that has some meaning in the world, a whole chair or a whole processor or whatever it might be, a whole piece of software. And so I was trained to think in that kind of top-down way about what the whole was going to be, what the finished synthesized piece was going to be. And so I describe that as as kind of a Newtonian view of design, right? I expect, I kind of intuitively want to take a top-down look. I want to be able to see the whole solution. I want to be able to see the whole thing. One of the reasons why designers develop visual tools for describing the idea is because it allows you to see the whole thing, right? You can draw it, or you can model it, and you can see the whole thing. Now, and that's great when the thing is not so complicated that it's impossible to model or impossible to see. So when it's a bottle or a chair or a table or even a building, you can do that. You can see the whole thing. But many of the systems, like a healthcare system, for instance, or even a whole healthcare institution, are complex enough that it's pretty much impossible to model it and see the whole thing. So in my opinion, we're in a bit of a crisis in design, because I think we're going to actually have to be required to sort of change the way we think as designers from this sort of top-down Newtonian view to what I would describe as a Darwinian view, which is based on emergence rather than on control of a top-down system. And that's fundamentally different way of thinking one that most of us as designers certainly aren't trained to do, which is a bit of a problem. But it's one that I'm very interested in. And I think we're learning, particularly through software and the designer software, how it's possible to develop, behaviors that are relatively precise and relatively small, and that when they accrete and add up to create these complex systems. And maybe we can build the kind of simulation tools and the modeling tools to allow us to understand how those behaviors might play out over time so that we can make appropriate design decisions. But I have no idea how this, I don't even know if I'm right about this idea, but I certainly find it very interesting. And I think it sort of causes me to question what you were just saying, which has always been my assumption, is that good design happens when you can see the whole system. And it's causing me to question it because I just think that's getting to be impossible. And so I just wonder, how we're going to tackle that as designers in the future. So not an answer, I'm afraid, but maybe more questions.
Good afternoon, Mr. Brown. Have you ever heard of Calvin and Hobbes?
Yes, I mean, coming from Britain, I wasn't as avid a follower as perhaps you were, but yes.
I read a quote one time where Hobbes asked Calvin, what kind of mood do you have to be in order to be creative? And Calvin responded, last-minute panic, which I agree with when it comes to creative and design thinking. Do you think that we are making things way too complex, and when we're under pressure and we have last minute, we put out something that really the end user just wants something simple in the end?
There's a bunch of interesting things that you bring up there. I'd start off by actually disagreeing that last-minute panic is the best emotion for design. Last-minute panic is the best emotion for getting design done, but it isn't necessarily the best emotion for design. I think actually, certainly as far as in fact, there's some really interesting research that's been done. I think for other reasons, but that have shown that you put somebody in a position of danger or panic, and their ability to think creatively shuts right down for perfectly good reasons, because they're thinking about survival, not about alternative options. So, for instance, a good friend of mine is who actually is just taking over running the Media Lab and is also an avid diver. Talks about how you put an inexperienced diver into the position of losing their air supply, and they have no idea what to do. There are all kinds of things they could do, but they don't make good decisions. An experienced diver that can distance themselves from the panic when that happens can make the right choice. And there are just lots and lots of examples of where putting somebody in a position of panic shuts their creativity down. So that would be my initial response to at least get us to think about whether that's a great place to be emotionally. Whether in terms of what users want in terms of simplicity, of course. I mean, we all want interfaces with the world that we can understand, and that we can respond to, and that we can kind of get our heads around, and that we would often describe that as being simple. We want a door handle that when we walk up to a door, we understand how to grip it, we understand what to do with it in order to get through that door. We want a phone that we understand what how to make a call on, or how to press a button, whatever. Of course, we want those things. My belief is that with many of the systems that we're designing for today, even including the door handle, to be really frank with you, that simplicity always lies on the far side of complexity, not on the near side. So, in other words, as designers, we have to understand the complexity and get through to the other side of it in order to create something that's simple for a user. So, the best example is, if you take, Apple products. I think we all, they tend to get a lot of praise for being apparently, at least, certainly in the early days, I think it's still true, simpler than most of their competitors. Well, I can assure you the reason they're simpler is because more design effort has gone into them, not less. That it actually is much harder. That you have to make harder choices, and that's often the issue. It's about being willing to make choices, being willing to edit out things that turn out to be less necessary, in order to get to the simple solution. So I completely agree with you that we want simplicity. I would argue that just takes a lot more work. It's good news for designers, of course.
Fran?
Nick?
Tom?
Nick, we've got one.
Oh, you've got, okay, yeah.
Hi,
Pam.
Tim. I'd be interested in your comments on how many different applications across the globe utilize design thinking? For example, does NASA employ design thinkers? And the second part to that question is, across that spectrum, where does healthcare fall? Are we front runners? Are we catching up? Are we somewhere in the middle?
Great question. So I'm sure there are sectors of society that don't use design thinking, but I'm having a hard time thinking of what they are right. I mean, what they are. I mean, I think NASA certainly does. We've worked with NASA quite a bit, and NASA has actually used designers for a very long time. We are finding ourselves working, and other designers finding themselves working in most aspects of government today, if not in this country, then other countries. Almost every sector of business. There are some, you could say some of the commodity industries, for instance, where it's less obvious where design plays a role, but it does. I mean, even if it's only the design of the massive pieces of machinery that mine coal or drill for oil. I mean, there's design there somewhere, and designers working there somewhere. I can't think. Even, I mean, to be honest with you, one of the most avid followers as a sector of design is the military. Now, we tend to make very careful choices about how we work with the military because we have a value inside IDEOs that we won't work on things that are designed to kill people or harm people. But the military are very avid followers of design and design thinking. So it's pretty much everywhere. I think healthcare is a very complex sector, and so there are pieces of healthcare that I'd say are trailing edge, and there are pieces of healthcare that are leading edge. I mean, for us in our business, I mean, healthcare is more than a third of everything we do. So it's by far the biggest single sector that we work in. So I suppose if that's any indication of where healthcare stands, I think it's pretty interesting. I think that the Mayo is actually at the leading edge of the application of design in healthcare because you're one of about 3 institutions that actually has designers working inside it. I mean, there are really hardly any, and so you're definitely leading the way. And I hope that we'll see great outcomes from the work that you're doing that will, encourage others to do the same. I mean, we're seeing some progress. The UK, for instance, National Health Service is using design. It's a little easier for them because it's got centrally controlled. We're seeing design in some of the Asian. I mean, we're working in Singapore, for instance, in healthcare with government quite a bit. In the Middle East. Well, one thing I'm tending to notice is that countries that run themselves a bit more like companies, in other words, they're small enough to be able to kind of get there. I mean, we've been working a little bit with the healthcare authority in Abu Dhabi, and they have 2 million 2 million customers, right? I mean, they're not patients, 2 million citizens. They screen every one of them every year. They know they know a lot about their citizens. So they've got an approach to healthcare and healthcare design, which is quite interesting because it's a sort of their customer base is smaller than yours at the Mayo, I suspect. So that's kind of interesting that we're seeing healthcare bubble up in those kinds of countries. We're seeing design thinking bubble up in those kinds of countries. So I would say healthcare there are places where it's really leading the world at this sort of system level innovation. I think government here in the US is only just getting interested in the relationship between design and healthcare, but it's beginning to happen.
What about education? We have some educators in the room. I met a teacher from St. Francis who's teaching design thinking to his 7th and 8th grade students. Are you doing any work in the area of education?
We are, because we're passionate about it for 2 reasons. I mean, we're passionate about it for the reason I talked about before, which is, it really frustrates me that, the vast majority of kids when they come out of high school have got no creative confidence, got no understanding of design methodologies, can't use those processes and skills in the rest of their lives. So that really frustrates me. And so we're interested in education for that reason, and we're working. We just launched something called the Human-Centered Design Toolkit for Educators. We actually did something similar. So there's a field guide for design thinking, which we actually created for the social sector because we don't do a lot of work in the social sector now. a couple of years ago. So we've now created a version of it for educators. It's free for anybody who wants to use it. We launched something called Open IDEO last year, which is a collaborative kind of crowdsourcing design platform that we now have. We have 17,000 people around the world helping us on our social design problems. Many of those are students. We're actually experimenting right now. We just did a pilot in Brooklyn with a school where we launched a kind of a private version of Open IDEO for a school, so that students and teachers can create their own design challenges and collaborate together on solving design. We're hoping to run some more pilots over the coming year. Ultimately, I'd like to see that getting out into the world. We're doing some curriculum design. Curriculum design is really hard because there are just thousands of school districts, and every one of them has their own approach to curriculum design. So that's a really hard thing to. We're working with some there's a big startup movement going on right now. New York's a big center for it, a little bit on the West Coast, around technology that's designed to support education. So it's some very interesting little projects we're getting to do there. And then, of course, we've always had a long association with university education. We teach in universities around the world. We helped found this thing called the D School at Stanford, which is in a way what for a university what the Center for Innovation is here at Mayo. It's where graduate students from the business school, the medical school, engineering school, business school all come together and work on collaborative, interdisciplinary design projects together. And so, I'm hoping that we'll start to see more things like that get launched around the world.
There's a question back there from Jim Steckelberg.
Thank you. Most enjoyable and informative discussion. Thank you. And you mentioned a little bit about the characteristics of individuals who are good at design thinking, and you mentioned some examples of large organizations or bureaucracies that are pretty good at it, and I'm sure that you could mention some that are not so good at it from your experience as well. So how would you characterize, more from a cultural point of view, what makes organizations adept and able to do good design, or the flip side of that is what are the major barriers you've seen?
I think, not surprisingly, cultures which are good at the loop between taking risks and learning from failure or success of those, tend to be good at design. So places where there's enough of a sort of safety net, as it were, to take risks, but there's a rigor about learning from what happens when you take them, tend to improve through design very quickly. So that's important. There's a sense of optimism is really important. If you're not optimistic, it's really hard to be creative, because you go into something not knowing what the answer is going to be, and you have to be optimistic that you're going to get to a solution. And so overly skeptical organizations have a really hard time using design effectively. Overly hierarchical organizations have a hard time using design. At least, there are different forms of design. There's a form of design which is the kind of, it's something often what we think of the traditional form of design, which is the sort of design superstar, the sort of the design priesthood, the guys that wander around in black turtlenecks and designer glasses who decide everything for themselves, I think when we think of fashion designers or even some of the great industrial designers or great architects, that's what we tend to think of, these individuals who are these brilliant people who have all their own ideas. And one is that's rarely true. They're just not admitting it. They often make use of large teams to do what they do. But secondly, is those people tend to have a hard time dealing with complex design problems. So cultures that are very hierarchical, where one person does all the talking and does all the decision making, tend not to be very creative, in my experience. And so you want a culture where there's a high bar, but where in terms of kind of constructive criticism, but where it's the best ideas can come from anybody. It's why I believe in our organization experimentation is so important, because it's through experiments that are often emerging out of the organization that we find some of our most interesting ideas for the future, because they certainly don't come from me. And they don't come from the other few people that have been kicking around IDEO for decades. They come from the work that we're doing. They come from the patterns that people recognize through the work that we're doing. And so experimentation is a methodology, if you like, for surfacing those ideas and doing something useful with them.
I think I'm sorry, we got one more, one more brief question? I'm sorry we couldn't answer all the questions, but that will help us the next time.
I was just wondering if you could give us a little bit of a vision for if you could imagine design thinking fully integrated and implemented in medicine and healthcare, what would be some of the fundamental changes and shifts that you would see?
Well, again, I don't know if I can answer the question before we've asked it in some ways. I don't know what those solutions are going to be. There are some areas which I'm particularly excited about design getting involved in, and one of those, for instance, is in the whole area of chronic disease and behavior change. I think it's pretty obvious that much of chronic disease is going to be solved not by only what you guys do to fix people when they're sick, but what we do to change the lifestyles of people so that they don't get so sick in the first place. That's behavior change, right? And we've had a pretty good track record of using design to help that in the past, sometimes to create bad behaviors. I mean, design's really good at creating bad behaviors. We make beautiful food so that people eat too much of it. We make great packaging so people consume so much stuff. So I'm really excited about the idea of design getting in on the act of actually trying to design things that help people have better behaviors. Whether it's things that encourage people to be fitter, whether it's things that encourage people to eat better or be better at taking the drugs they're supposed to take. So we're beginning to learn about behavior change and how complex and interesting that is. So that's one area. Another area that I'm particularly interested in at the moment, that seems a bit esoteric, is synthetic biology, because I think before long, designers are going to be designing with living organisms, right? I mean, you guys are experimenting on living organisms, have done forever. But now it's pretty clear that we're going to be designing with living organisms before too long. We're already seeing it, beginning to see it in materials. We're beginning to see materials appear that at least behave as though they were living, even if they're not actually living, and eventually they will be living. So right now I've got a group at IDEO, team at IDEO that's working with the synthetic biology lab at UCSF, just doing experiments in synthetic biology, just learning about it and learning how they might apply design to it. So that's a slightly more on the esoteric side. I think, there's a place for design in how we make healthcare more efficient. I think a lot of that, to be honest with you, if we look at other industries which have got more and more efficient, they've actually taken a lot of the burden that now rests on institutions and professionals. Some of that burden has to ultimately get put on our shoulders as individual consumers and individual people. It's inevitable, right? I mean, whether that burden is on having more information about ourselves, whether that burden is on acting more in our own self-interests, whether that burden is having technology that allows us to know what's going on with our own bodies a little bit better, so that we don't wait till we're really seriously in trouble before we come and see you, but maybe we come a little bit earlier. I mean, they're all ways in which I think ultimately we're going to have to shift the burden a little bit over to the consumer or the individual and help make healthcare more efficient in the process. So I think they're all places where design can play a role, and there are many more too. It's super exciting. I mean, it's one of the reasons why I feel extremely privileged to be able to be associated with what you're all doing here, because I can assure you I learn every bit as much from coming to the Mayo as the Mayo ever learns from me, and because it is one of the most fascinating and important areas where I think we should and can be working.
Well, we're at the end of the hour. I want to end by thanking all of you for coming and inviting all of you, if you have any comments about today's session, our plans for the future, any suggestions, just send me an email. We very much would like feedback and input. And I want to thank my good friend Tim Brown for taking 2 days out of his very busy life to spend time with us, and I hope all of you enjoyed this last hour as much as I did. So thank you very much.
Thank you. Thanks.
I'm going to volunteer Tim for a few minutes afterwards if people want to come up and ask him any additional questions.